day and welcome to Urban Health Beat 2.0, the podcast, your source for healthy information, which Dr. Jennings and I have given in the past. And we are the show that feeds your mind, body, and spirit. And today we actually are going to be feeding all three. We have a guest that is phenomenal, and Carol Douglas. I'm going to call you Dr. Carol Douglas, but Carol Douglas.
Okay, it's fine.
It's okay. I'm going to call you Doc.
Yeah,
Is our guest. And let me just tell you a little bit about Carol. And quite frankly, one of the reasons why we were doing this very special show, which is part one of a series, a two-part series, is because in today's world, when we face the COVID-19, which is called the coronavirus, we all have various emotions. We have various emotions. It's Palm Sunday. We can't even go to church, which is really weird for me because every year, for as long as I can remember, my church, which is an Episcopal church, which Dr. Douglas has been a part of, has done the blessing of the city every Palm Sunday. So it was really strange waking up to Palm Sunday. But so we all have various emotions, and we have our spiritual energy connected with these emotions. Like today, we know that there are millions of people who have been infected with the coronavirus. And quite frankly, there are 9,000 deaths. And that is a whole nother dynamic that affects us all as a world community. And we are speaking with Carol Douglas today to kind of give some perspective to all of that. So welcome, Carol.
Thank you so much for being here. I'm excited to be here.
I'm your host, Marilyn Harris Davis, and
I'm Dr. Gary Jennings, and you're listening to us on the Be Inspired Global Network.
Absolutely. Let me just tell you a little bit.
Listen to us more often and see all of our podcasts.
I
agree with you. I agree with you, Marilyn. This is a scary time that we're in. You know, I was imagining must have been what it was like in the beginning of World War II.
Wow.
When the United States was losing and all you heard was bad news on the TV, at that time on the radio. And, you know, you never knew when you might be attacked, and people were staying in their houses, and there was suspicion of neighbors. We didn't have the 6 foot, stay apart from each other for 6 feet, but it was a very scary time. I imagine, I'm not that old, but I imagine it was a scary time.
Yeah, it was a scary time. And quite frankly, you may be that old, but never mind. We're not going to go there. No, but seriously, that was a scary time, and we have never seen a time like this. The whole emotional distance thing, and the topic of our show today is the effects of spiritual and emotional distance. And as I've spoken with Carol Douglas, we were trying to separate the psychological differences between the emotional differences, but they are so intertwined. They're so intertwined. So we are going to take this next half hour to start this conversation, and we will completely continue with that. But I want to tell you a little bit about Carol Douglas. The Reverend Carol Douglas is a native of Baltimore, Maryland, and a cradle, and I love that word in your bio, Carol. I love that word, a cradle. I guess that means born.
Yeah.
And Episcopalian. She was educated in the Baltimore City Public Schools. Reverend Douglas served as an assistant rector of the historic St. James Episcopal Church, one of the first, or the first Black Episcopal Church in Maryland, and served as the rector of the historical St. James Episcopal Church under the rectorship of the now presiding Bishop Michael Curry, whom we all know and all love. I mean, like worldwide, all love. Dr. Douglas, I call her Dr. Douglas, Reverend Dr. Douglas, but the Reverend Douglas enjoys teaching, preaching, and pastoring as an invited preacher on many occasions because I've seen you in Annapolis, Carol. I've seen you in Baltimore. I mean, you are invited and people just love your perspective. integrating what is spiritually healthy as well as mentally healthy. So she has literally preached from coast to coast over the years. Currently, Reverend Douglas serves as a nurse and a counselor to persons and families who are substance affected. She also works as a psychotherapist, counseling children, couples, and adults. And we're going to get back to you with that couples thing because, you know, as we're all here, you know, coupled up together, that's a whole nother stressing point.
Yeah.
So you work in several arenas. And thank you so much, Carol Douglas, for being with us. I so appreciate it.
In addition
so
to that, you forgot one thing. She's also a registered nurse.
Oh, well, yeah, I mentioned that, but she is. And that is a whole nother dynamic and perspective. That's what I'm saying. You know, the spiritual, the physical, and the psychological perspectives. That's why we are doing a series. So thank you so much. So we're going to start with the fact, and as you and I have had conversations prior to the show, we're going to start with the fact that there's so many people throughout the world dying of the coronavirus. Everybody is scared. Not everybody. A lot of people are afraid, but there are those of us that have faith in God, and we know that He's protecting us. We don't know what this message is, but that's my personal perspective. But with that being said, as we had spoken earlier, there are several levels of our fear. There's grief, there is economic disturbance, there is a family disturbance. I mean, we can't hug each other, we can't love each other. I mean, look at this is Palm Sunday. I can't believe that I'm not out in front of City Hall doing the blessing of the city. So, you know what I mean? And next Easter, you know, I mean, we're going to try, my family's going to try to all zoom in and try to have an Easter celebration and show everybody cooking and me getting carry out, but I'm just saying. But yeah, those are all things. So tell us where we can start with processing this solitude and the social isolation that we all find ourselves in.
Sure. So when you hear the term social isolation, that term in itself conjures up a lot of images that sound very desperate, sound very finite, and at some level, for many people, it's a misnomer. We aren't isolated; we're restricted. Okay, and part of, as you mentioned, we didn't have a chance to get prepared for this, so to speak.
Yeah, no problem.
It came on us, you know, in terms of you have to do this now. So we didn't get a chance to prepare. We have been stripped away from a lot of the things that we used to do, and we almost have to spin on a dime. Human beings don't change very well, and they certainly don't change very quickly, no matter what the circumstance. It takes time for us to acclimate ourselves to the fact that something is different, no matter what it is. And as you mentioned, Marilyn, we have found ourselves in some very different positions, very different types of relationships. We're now in the house with people we used to be able to get away from at least for 8 hours. Now we're...
It's true.
So now, and we can't isolate in the house because they know where to find us. So it is isolation in terms of we now have to make some decisions about how we interact with people. But what has not been restricted is the fact that we can still become social creatures. We're created to be that way. That's who we are as human beings. We are created to be in relationship. The way we relate now is very different. It isn't as free as it used to be. So the first thing is that we feel fearful. The first thing that comes up is fear and then grief. Fear because, number one, we are not sure when we're going to get our lifestyle back. And the second thing is we're grieving what we used to have, our ability to have that freedom, our ability to make decisions about who we interact with and when we interact. And because we no longer have those choices, we're like in a scramble. And if we listen to the news, it increases our anxiety because they tell us daily about people that have died, people that have lost. They give us the image that this is an impending doom almost.
Yeah.
And so the scenario appears at one level to be very grim. But what we must also understand when we're faced with anything that causes us fear or causes us anxiety is that fear is actually emotion that we feel projecting what's going to happen in the future. Because if you think about it, we're thinking about what's going to happen tomorrow, what's going to happen next week, what's going to happen next month. And we're educated a lot by what we see, what we hear, even our experience. And as we talk about our experience, we really don't have, as you mentioned, we don't have
a reference point.
Right. Right. We don't have a reference point. So we don't even know how to think about this. But what we do know how to do is that no matter what the adversity, no matter what the struggle, we know where to go. And so for those of us who worship God, we know to go and look at the experience of people in biblical times who've gone through this. But everybody doesn't believe in God, but everybody has some kind of spirituality. I have not met anybody that doesn't admit to something greater than themselves. And, as we try to define what spirituality is at its core, that's basically what it is. The ability to humble yourself to something greater than yourself, to allow that power to interact and kind of take over. So for some people, it is a point of religion, like God or shaman or something like that. For some people, it is political figures, it is scientific figures, but it is someone that they believe they're willing to give up their power to listen to, that sees them as wiser and able to have the ability to get them out of their struggle. So truly at this time, I don't even think that the world is able to grapple with it to a point where we've just given up our own ability. And actually that's kind of good because when you talk about trauma, we still have some power. We still have some ability to be able to have some control over our lives. The coronavirus hasn't completely taken away everything that we are able to think and able to do. We can maintain the social distancing.
We can maintain family relationships that we may not have had person to person because of our social distance, state to state, country to country. But now we almost don't have a choice. And so it's like we can use modalities such as this one in order to maintain our social intimacy.
Exactly. But now it does force us to be socially intimate now, especially with people in our house. And we don't get a choice about who to be socially interact with.
I think this is a good time for us to reassess what is really and truly important. And you find that, for those of us who have family and are near family, that family is important. For those of us who are alone and can only look at family through modalities such as Zoom or Blue Jeans or whatever, then you actually see how important they are. I mean, we've moved so far apart away from each other, brothers in Chicago, mothers in Los Angeles, and now we see how important they truly are when we are, secluded and cloistered in our homes.
Absolutely. One of the things I wanted to ask you, Carol Douglas, is I was really intrigued by the conversation that we had about grief. You know, I've worked in the death care industry for many years, and we think of grief, which completely and totally is grief with people dying. And that's a whole nother conversation that we will have about people who are dying from the COVID virus and they can't even have funerals. But there are several levels of grief, and you are seeing those. So can you speak to that?
Well, in terms of the levels of grief, I think what you're referring to, I think we talked about the different types of grief. So there is the kind of grief when you lose a loved one, but grief is basically the physiological and emotional response that you have to a loss. And there are all kinds of losses. There's a loss of job. There's a loss of freedom. There's a loss of health. There's a loss of money. There's a loss of control, as well as the loss of loved ones. And that all gets experienced in our body in pretty much the same way. So grief basically is the loss of something that has been important to us. And for those who are like impending grief, in that we will lose it, I wanted to bring it back to one particular point, which is to say, to be here in the here and now. That's the way we deal with fear and anxiety. To take a breath and look at what you have right now. As one person says, yes, absolutely, absolutely be grateful for it. But before you can even be have some gratitude, you got to acknowledge what is actually there. You know,
Mm-hmm.
we're talking about the money that we're going to lose, but you know, thank God we still got money to be able to make food this week.
Something, right?
Right.
Or
Exactly.
to help other people.
Right, exactly. And the situation has brought into our lives people and places and circumstances that we otherwise would not allow. It's only when we don't have any choice that we're willing to allow the mercy and the grace of other people. I think crisis like this allows us to pay attention because number one, we don't have any choice.
God knows how to get your attention.
It does. And we're more receptive to hearing and seeing and doing in times of crisis than we are when things are going well. As a matter of fact, we're willing to pray and praise. You were talking about Palm Sunday. We are willing to pray and praise, especially in times like this. What is the first thing you do in crisis? Say, oh God, you know?
Right, exactly.
So it does allow us, there are, you know, some positives about this. If it were not for the fact that we had this, a lot of people wouldn't be talking to each other. A lot of people wouldn't.
Absolutely.
A lot of people would not be giving to each other, wouldn't even think about it. A lot of people wouldn't be even considering another career. A lot of people would not be considering what they could do if they didn't have their 401k or now their stock portfolio has gone down. So this has created a lot of positives in social interaction that otherwise probably would not have happened, or certainly wouldn't have happened under our own control.
Sometimes I think that's the way we have to look at this to reduce some of that anxiety and fear.
Yeah.
Is that you were saying, you know, hate to say it sound funny, but look for the silver lining and this dark cloud that's over us. We're just talking about that silver lining that you were just talking about, so that can help reduce our anxiety. And I agree, yes, living in today. You know, that helps. Look at what you have.
Living in the
all
now.
the benefits you
Living
have.
in the now. Right. Yeah.
Yes,
so, yeah.
Absolutely.
Absolutely.
And now it's not today, it's in the moment.
In the moment.
I mean, look, the three of us would have never had a conversation were it not for this, right? You know, we said we were going to do, but so now, this has happened. And in terms of living with children now in our homes and living with our spouses. A lot of times, you know, we don't want to have the conversations, or we don't want to have the interactions because we haven't practiced it. The technology has made it so that we don't actually have to practice courtesy and politeness and listening to other people for an extended period of time. And so it does call us to new duties.
It does. It really, really does. And now, let me just say, African Americans, from the statistics are, and I don't want to say more likely to get COVID-19, but we all know, the three of us, we all know that we are compromised as a people in terms of our health care. So I guess the point is, what I always say, and you're a psychotherapist, and Gary and you and I have had many shows to this point, is that white people go to a psychiatrist, Black people go to God. We pray. We know we pray. And that's our strength. And that has always historically been our strength. Have you seen, in terms of the mental health needs of the psychotherapy patients that you've had, any increase relative to this, and just in general? I mean, I'm just saying that, and that's why we're, having spiritual effects as well as psychological effects, because I think that they are intertwined. So.
Oh, absolutely. We are created mental, physical, and spiritual. It's almost like trying to get the eggs, the sugar, and the flour out of a cake. You can't do it. We are created as those parts of that, and it's never been my experience to have encountered anyone that doesn't at some point bring in all three of those dimensions in order to be able to survive, thrive, and live their best life.
Absolutely.
In answer to your question, yes, I've seen an increase, definitely, in terms of clients who I haven't even taking on new clients that are fearful and anxious and paralyzed, actually, by the fear and what they hear. And so part of that is we got to get a grip, because number one,
about the paralysis. I'm sorry to interrupt you.
They can't move, they can't think. They don't know what to do, and so they kind of go here and there, and they listen to any and every voice that tells them what to do. They buy this and buy that, not really thinking. And so one of the techniques to kind of get a grip on this fear and anxiety is, number one, take a breath. And I know people say that, but it actually works. If you take a deep breath, like into the count of 4, hold for 2, and blow out like a birthday candle to the count of 6, it will trigger the relaxation response in your body. Being able to do that will help you think clearer. And if you can think clearer, you can then say, wait a minute, let me stop and take a step back and look at what I'm thinking. Is this actually true? Am I actually going to die? Well, here's the thing: if you stay in your house and you don't breathe on people, and people don't breathe on you, and wash your hands and keep yourself reasonably clean, and don't have any immune problems, there's a very good chance that you will not catch the virus. And even if you do, if you have an intact immune system, you have a good chance of being able to survive it. So we have to look at, just because it's out there for the whole world, where do you fit into this picture? Where is it for you? Do you have good hygiene habits? Are you willing to walk out with a mask when you go out, just to make sure? And the mask isn't so much for you as it is for somebody else. So this is a matter of self-care, of taking care of your brother and sister.
It's interesting. I was in Annapolis today, the world is in different phases of this dynamic. But I was in Annapolis today, which is pretty much a resort town, I guess. I don't know. But folks were like, this is just April and it's a beautiful day. And nobody was really looking like they were concerned about this. And it concerned me. But I mean, I guess it's a matter of perspective. And it's a matter of, and this, we will get to this in the second part of our series here about the socioeconomic differences between all of us. You know what I mean? So
Okay.
that's a thing, right?
Well,
Well, yeah,
I'm
I think
thinking
that-
it is a beautiful day. I was
Mhm.
thinking that it is a beautiful day and people want to be out. However, for the safety of your neighbors and the safety of your family, you just have to look at the sunshine from the window or from the side of your home, like I'm doing. You can't go out and just, do things that you would ordinarily do on a fantastic Palm Sunday. You just can't.
Well, yeah, you can't without precautions, but
I think
But-
people are going to start to get battle weary as this goes on. They can
Mm.
do things like this for a short time, but as it goes on week after week after week, they get weary of the discipline that it takes to
absolutely.
be able to maintain this kind of regimen.
Absolutely. Yeah, this
So how do we maintain that discipline? How do we do that psychologically?
My experience has been that it's more about what you do than what you say. So if you're wearing a mask, it kind of shames me into wearing one, or at least thinking about it. If you remind me that I need to stay 6 feet away, then I'm more willing to do that too. So, passing on that good, passing on that example of how we take care of each other. And even, labeling is that. It's not about the fact that I don't want to get near you. It's the fact that I care enough about you to make sure that I do what I can to keep you safe. And so people are willing to receive those kinds of gifts, of kind of acts of love. And when you frame it like that, they can't get mad.
Can't be bad. And with the holidays coming up, it's like, I know with my specific family, I'm just feeling like, wow, because we all get together on Easter, and that's when, Christ rose from the dead. I mean, we all celebrate that. I get it. But what we're going to do, it's my suggestion, since we have this Zoom app and everybody has, well, not everybody, some people, they have FaceTime and all, we're going to all try to get together on FaceTime and, and then just still do whatever we do. Somebody will cook. I will probably order out, but I don't know. But we will all, and we'll all just talk and do whatever we do. I mean, we just have to work through this together, but also know that Easter is a major, major day for all of us.
When you say that, I think about the story of when the Israelites crossed over into the desert and they left that lifestyle.
Yeah.
Everything changed. What they needed, what they had, what they were used to, and they couldn't go back. They weren't going back over the sea to go back into slavery. And so it necessitated the fact of, let's take a breath, and this is where we are right now. Okay, we're in the, we got to learn some technology now today. We're not going back to, what we used to, and we may never get back for a long while for this, even, once heaven thankfully will get over this crisis, this health crisis, but it won't be anytime soon. And so we have no choice, basically, but to do things differently, and that's a good thing. Just because you do it the same old way doesn't mean it's the right way to do. And isn't it fun to get up and consider, how you do Zoom and figure out that your iPad doesn't work, and
I know, cell phone, this,
Need
that, and other.
earphones, yeah.
I know,
you need earphones, and Marilyn, you're gonna have to cook, and
I know, right? I was telling my husband, like, so like, we're gonna do like spaghetti this week.
We'll send you recipes,
Thank you. But one of the things I saw last night, and I know we have to wrap up a little bit, and this has been something I've watched for years, and I know that you do. And I don't know because they don't promote it a lot, but you know the Ten Commandments, right? Obviously,
Yeah.
we all know the Ten Commandments, but the movie.
You're asking her if she knows the Ten Commandments. I love that.
You know, okay. I'm just saying. I didn't mean to say it. But the movie The Ten Commandments with Charlton Heston and all of that, I saw it. I was because I didn't want to watch any of this, COVID virus stuff and all of that. And I was changing the channels and I was like, oh my gosh, the Ten Commandments were on. I cannot even tell you how inspirational that was to me. I mean, it was just like, I don't care how many years I watch it, it is still an epic adventure. And one of the things, speaking to your point, Carol, is that it's not because, when God opened the sea, the Red Sea, it wasn't like everybody just flowed through there to the other side. They were, everybody had to pick up the mules. They were all fighting. And I mean, not fighting, but they were all doing what they had to do. It was not an easy trial. It was not an easy trip, but they did get to the other side. And in my spiritual mind, I thought that, yeah, this is what this is going to be like. You know what I mean? It's not going to be easy, but we will get to the other side.
Right. And everybody didn't go. There were some that were left on the other side that said, I'm just not going.
Not gonna do it.
Whenever you live in community, everybody's not going to be on the same program. But it is that faithful remnant that's willing to go ahead and forge ahead and be the example. It's a good thing to have information, but I think what actually solidifies it for us is the experience of having to use the information.
Absolutely.
I think that's the difference between knowledge and wisdom. It's good to know what to do, but wisdom is the right use of that knowledge at the right time in the right situation.
Absolutely. Dr. J, do you have any words of wisdom for us relative to
Yes.
what we're all going through?
Wash your hands,
Okay.
wear your mask,
Yeah.
and stay 6 feet away from each other at least.
What do you
No
think about
gatherings.
What do you think about this whole
Gotta-
mask thing? Does everybody need to wear a mask? I mean, I'm doing it.
I'd say yes, everybody needs to wear a mask. I know they're trying to say save some masks from the hospital so that nurses and doctors can wear them. But unless you want to be a patient, in the long run, you should wear a mask. And be careful of the masks that you buy, because you can go on Amazon and buy a mask, and it may not be the mask, it may not be what it's actually used for. Someone is sitting up someplace making masks out of stockings or sheets, and they look pretty, but they may not
I
be
wouldn't say
effective.
stockings. Okay, let me just say, I'm not clear that anyone would be doing that, but okay, I get your point.
You'd be surprised with some of the masks that you see.
Really?
And they're made out of jersey and cotton and things like that. And that's not I mean, it's better than nothing,
Better than nothing.
but it's not what you should be spending $10 on.
Yeah. I obviously wash my hands, but when I wear gloves, I also wash the gloves. I don't know if that's, but I just. I mean,
Well, I think that gloves,
put hand sanitizer on the gloves.
yeah, well, gloves should remind you not to touch your face, because people wear gloves and touch a button and then they touch their face with the gloves. The gloves should just when you see this funny looking glove coming to your face, it should say, oh, don't touch my face. And that's where I see gloves as a benefit, not to save your hands from
And
anything
people
else.
who bite their nails, I mean, it's just like a thing, Do you know?
Hey, get a new habit.
It's a new habit. Carol, you were going to say something?
I was just gonna say, I guess
As
as
a
a
nurse?
nurse, I'm not a real big advocate of hand sanitizer over washing your hands.
Okay.
That friction with the soap is what actually gets rid of the germs off your hand. Hand sanitizer will kill the germs so they can't transmit, but they're still on your hands. So I'm like, go get some soap and water and wash them off.
This, and this. Okay. Right?
Yeah, so nothing beats soap and water. And soap and water will work for washing your clothes.
Mhm.
So as we, find that hand sanitizer and the things that we need tend to be in short supply, we can always use good old soap and water.
Mhm.
And all the other things that Dr. Gary said, absolutely look at what your your mask. Your mask basically, here's what I tell clients. So if I'm just talking to you, my spray, because if I were to go into a mirror and blow my breath, you'd see the fog, and that's the droplets that we're talking about. And that's usually 1.5 feet just in conversation, but they're heavier than air, so they drop to the ground. When you cough or sneeze, that spread goes to about 3.5 feet. So that's why we say 6 feet. That sounds like a safe distance, even if somebody accidentally coughs. But given the fact that we may be carriers, even if we don't have symptoms, if you cover your mouth with a mask, then you decrease the amount that can even spread to 3 inches or something like that. So I think that's the science behind it, or the logic behind everybody just wearing a mask.
Yeah. Okay, we are going to come back with part 2 of this series with Carol Douglas, the Reverend Doctor. That's what I call the Reverend Doctor, Nurse, everything. Carol Douglas, who has been so amazing for us. And we all need to be spiritually healthy, and we all need to be psychologically healthy. Just keep our focus on what we need to do, and on our families and ourselves and everyone else. It's a lot to handle, but that's where we are. Now, we know that laughter is the best medicine, and actually our intro music is the happy song. And I want us to stay happy, because happiness is what we need to have right now, whether we're here, there, or anywhere. So I'm going to ask you, Carol Douglas and Dr. Jennings, but don't answer, Dr. Jennings. Why did the cookies go to the doctor?
I have no idea. Why did the cookies go to the doctor?
Because it felt crummy.
Oh my gosh. Oh my goodness gracious.
I'm going to give you one more, because Gary, you didn't even have anything smart to say about that. So why did the golfer bring 2 pairs of clothes to the golf course? Because he had a hole-in-one. Okay, so.
Oh my gosh.
You stay safe, everybody. You have been listening to Urban Health Beat 2.0, the podcast with Carol Douglas, our amazing, amazing nurse, minister, psychotherapist, and Dr. Gary Jennings, our amazing anesthesiologist, and my brother and co-host. And remember, until next time, your good health is a work in progress. So
work it.
Work it.